Pancreatic cancer has a very poor prognosis, with a 5-year survival rate of less than 5%. The reason for this is that symptoms often don't appear in the early stages, making it difficult to diagnose, and once diagnosed, it progresses rapidly, leading to a high mortality rate. Most patients are diagnosed when the cancer has already spread. It has been found that the probability of developing pancreatic cancer increases by 63% if diagnosed with certain conditions. Doctors often fear pancreatic cancer because, even after surgery, the 5-year survival rate is only 14.3%, which is slightly better than the general survival rate of less than 5%. The reason for this poor prognosis is that pancreatic cancer is usually diagnosed after it has progressed, and only 20% of cases are eligible for surgery. Even if the cancer can be surgically removed, the survival rate remains low because the response to chemotherapy and radiation therapy is weak. The pancreas is located behind the stomach, surrounded by the intestines, liver, and spleen, making it hard to diagnose. In the early stages, symptoms are almost non-existent, and early detection is very difficult. As a result, about 40 to 50% of cases show distant metastasis at the time of diagnosis. Even without metastasis, the rapid progression leads to a high mortality rate. Distant metastasis refers to the spread of cancer to organs like the bones, liver, and abdominal cavity. Before pancreatic cancer is diagnosed, many patients experience warning symptoms such as fatigue, loss of appetite, digestive disorders, back pain, and weight loss. Pancreatic cancer often presents with symptoms that are common in digestive disorders, such as abdominal pain, anorexia, weight loss, and jaundice. The symptoms may vary depending on the tumor's location, size, and extent of metastasis. Most patients with pancreatic cancer experience abdominal pain and weight loss, while jaundice is common in those with tumors in the head of the pancreas. Pancreatic tumors in the body and tail of the pancreas typically show few symptoms in the early stages, so they are often diagnosed later. Decreased insulin production from the pancreas may also lead to diabetes symptoms. Unexplained digestive issues and loss of appetite can be signs of pancreatic cancer. The pancreas produces digestive enzymes like amylase and lipase, and when their secretion decreases due to pancreatic issues, digestion becomes impaired, leading to digestive disorders. Back pain when lying flat can also be a sign of pancreatic cancer. The pancreas is located behind the stomach and in front of the spine, so pain may occur in the back when there is a problem with the pancreas. Additionally, when the abdomen is palpated, there may be no pain because the pancreas is located behind other organs. This characteristic means that pain may not worsen with palpation, making it harder to detect pancreatic cancer. If diabetes develops without any clear cause, it could indicate pancreatic cancer, as insulin production in the pancreas decreases. Yellowing of the skin, or jaundice, can also be a sign of pancreatic cancer. When the tumor is located in the head of the pancreas, it can block bile ducts, leading to a buildup of bile and causing jaundice. If jaundice occurs, it is important to consider liver and bile duct issues, but pancreatic problems should also be taken into account. Another potential cause of pancreatic cancer is periodontal disease. A study conducted between 1986 and 2002 showed that men with periodontal disease were 63% more likely to develop pancreatic cancer compared to those with healthy gums. The risk was even higher in men who needed tooth extractions within 4 years. Researchers believe that bacteria and inflammation in the mouth may play a role in the development of pancreatic cancer. For the prevention of pancreatic cancer, it is essential to avoid certain foods. Fried foods, such as fried chicken and French fries, are high in fat and carbohydrates, which put stress on the pancreas and promote inflammation, increasing the risk of pancreatitis and pancreatic cancer. Saturated fats, commonly found in red meats like beef, pork, and lamb, also strain the pancreas. Processed meats like ham, bacon, and sausages, which are also high in saturated fats, should also be avoided. Alcohol is another risk factor for pancreatic cancer, as it can cause pancreatitis, impair pancreatic function, and increase inflammation. If there is a family history of pancreatitis, alcohol consumption should be strictly avoided. Another harmful substance is fructose, which is found in both natural and artificial sweeteners. Although naturally occurring in fruits, fructose is often added to processed foods and drinks in the form of high fructose corn syrup. Fructose leads to the formation of advanced glycation end products, AGEs, which can damage blood vessels and organs, contributing to the development of chronic pancreatitis and, over time, pancreatic cancer. To prevent pancreatic cancer, it is recommended to avoid the consumption of red meat, fried foods, sugary drinks, and processed foods. If you must eat these foods, it is better to consume them alongside vegetables to reduce their absorption and minimize their impact on the body. Drinking water or tea instead of sugary beverages and prioritizing fruits, vegetables, seaweed, and whole grains like brown rice can be beneficial for pancreatic health. Avoiding excessive meat consumption is ideal, but if you do consume it, grilling or steaming is preferable over frying. Eating a balanced diet rich in fiber and plant-based nutrients is helpful for maintaining pancreatic health. Additionally, it is important to adopt healthy eating habits such as eating in moderation and chewing food thoroughly. Some supplements, such as curcumin and omega-3 fatty acids, may support pancreatic health due to their antioxidant and anti-inflammatory properties. Consuming digestive enzymes regularly can also reduce the burden on the pancreas. One crucial method to protect your pancreas after the age of 50 is to maintain healthy sleep habits. Adequate sleep plays an important role in cancer prevention. Insufficient sleep can lead to increased fatigue, weight gain, a decrease in cardiovascular function, and the development of chronic inflammation, which negatively affects the body overall. Studies and clinical trials have shown that a lack of sleep results in higher levels of inflammation markers, such as CRP, which is associated with various health issues. Therefore, it has been revealed that getting around 7 hours of sleep per night is essential in reducing chronic inflammation, which can ultimately help prevent the development of cancer. By improving the quality of your sleep, you help lower the risk of chronic inflammation, which is a key factor in the development of many diseases, including cancer. Pancreatic cancer is one of the most difficult cancers to detect early, and its treatment outcomes are extremely poor. Therefore, prevention is the most effective strategy. Key components in preventing pancreatic cancer are diet and lifestyle choices. Among these, the most important factor is avoiding harmful foods. It's crucial to avoid foods rich in animal fats, fried foods such as French fries, sugary snacks, energy drinks, fruit juices with high levels of fructose, and red meats, all of which can put stress on the pancreas and increase the risk of developing pancreatic cancer. If you find it difficult to completely eliminate these foods from your diet, try to eat vegetables rich in fiber beforehand. Fiber helps to fill your stomach, and it can absorb harmful substances, reducing the absorption of fat and sugar. This helps to excrete those substances from the body through stool, which may reduce the burden on the pancreas and lower the likelihood of developing pancreatic cancer in the long term. By making these dietary and lifestyle changes, you can support your pancreas and improve your overall health, potentially preventing the onset of serious conditions like pancreatic cancer.